Hi, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and today I'm coming to you live from the lovely waiting room of our dental practice here in the Brookhaven suburb of Atlanta. And today I'm going to answer a very commonly asked question, and that is, do I really need a filling? Often I'll have patients come to my dental practice for a second opinion. Our dental practice has a reputation for being very minimally invasive and conservative in our treatment philosophies and recommendations. We don't want to drill on your teeth unless we have to. So these patients will come to me and say, Doc, I've been told I need 4 or 5 fillings. I don't have any pain. My teeth have been fine forever. I brush and floss nicely. What's going on? So let's answer this question. Do you really need filling? First of all, a quick rundown of what is a filling. I've got another video that goes into much greater detail about this. So I'm going to spend just a few seconds on it. Filling is fake tooth structure. If your tooth is rotten or decayed or broken and you're missing tooth structure, the way you get it back often is with a filling. There's 2 kinds of fillings. The first one are white fillings. They're also known as composite resin fillings. This is pretty much all we do nowadays. It's a good, strong material, and people are usually happy with it. The other kind are silver fillings, also known as amalgam fillings. We don't do any of these anymore. Very few dental offices still do silver fillings. They're good, strong fillings, but in today's society, most people don't want metal fillings, so that's why we don't do them that often. So now that we've covered what a filling is, let's get to the good stuff, which is, do I really need a filling? Let's go over 5 situations where you may or may not need fillings and go into good detail about them. All right, so first of all, the most common reason people are usually getting fillings are cavities. Cavities are essentially where your tooth has rotted out and become decayed, and now it's no longer solid and healthy, strong enamel. It's kind of this mushy brown decayed enamel. One type of cavity is a chewing surface cavity. This is as a result of maybe not brushing that well. Little food particles get stuck on the top of your tooth and it slowly starts dissolving it away. The food particles have bacteria on them. The bacteria produces acidic byproducts and this starts rotting out your tooth, and now you've got a little black spot or a little rotten spot in your tooth. The way I usually diagnose these is I look at your teeth and I look to see if there's anything funny going on over there. And B, I take my little pointy instrument and I poke over here. If my instrument goes and gets stuck there, then yeah, you probably have a cavity there and you need a filling. Now, sometimes my instrument won't get stuck there, but I'll see something that looks abnormal. This is when you can ask 3 different dentists 3 different questions and they'll give you 3 different answers. The way I usually do it is, if it's a little tiny brown spot, then I'm not worried about it, especially if my instrument is not getting stuck in there. If it's a really, really dark brown or black spot, then I take other factors into consideration. For example, the age of the patient. I've got many 70 and 80-year-old patients that have had black spots on their teeth for years and nothing has happened. So on that person, I'm probably leaving it alone. And I have many 13 and 14-year-old patients who have a history of eating candy all day long and not brushing their teeth, and as a result of it, they've had lots of cavities. So if I see a dark brown spot on one of those patients, I'm probably going to recommend a filling because I know the history of this child, and I know they haven't been brushing and flossing very well, and it's going to be in their best interest to have a filling and get rid of that tooth structure. So that's topic 1, chewing surface cavities. The other type of cavity you can get is in between the teeth. These are flossing related. Food gets stuck over here, maybe you don't floss it that well, or if you drink a lot of sugary drinks and expose your food to sugary foods too often, you can start getting decay between your teeth. These I cannot diagnose with my naked eye. I need x-rays in order to be able to diagnose these, and there's different sizes of these. So once again, if I have a really, really small one, I'm probably just going to leave it alone and keep an eye on it. It's not worth drilling away a whole bunch of healthy tooth just to get to a tiny little cavity over there. And sometimes that cavity will just stay by itself and not get any bigger, especially if the patient changes their habits. But if I see something this size, where it has crossed over from where the heavy enamel is into the softer dentin, yeah, I'm going to recommend a filling on that tooth. And then you've got a whole bunch of stuff in the middle. Let's say it's about that size. Well, sometimes I'll do a filling on that. Sometimes I'll just leave it alone. Once again, I take other factors into consideration before I determine whether or not I need to recommend a filling for this person. So we talked about that. Now, finally, a third type of cavity is a root cavity. I don't see too many of these. Usually the situation, and this is where you have a cavity way down in your gum line, right where your tooth ends and your gum begins. Usually something else has to be going on for people to get root cavities. Let's say they have gone on new medications, which is drying their mouth. They've undergone chemotherapy or radiation treatment, and they've got some other predisposing factor. Those are usually the situations where I see root cavities. All right, so we talked about cavities. Now let's talk about number 2, broken or chipped teeth. Sometimes these need filling, sometimes they don't. The million-dollar question is, how big is the piece that broke off? Because we can either do nothing or do a crown or do a filling on it. This is a big old part of your tooth has broken off. 9.9 out of 10 dentists are going to agree that this tooth needs a crown. You can't do a filling on it. I mean, you could do a filling, but it'll probably break off because there's nothing there to hold the filling. You can't just glue a filling onto the tooth. You have to have something kind of locking the filling into the tooth. So this definitely needs a crown. You can't do a filling on that. So I did a very, very detailed, lovely drawing here with my hands. So this is a normal tooth. If you got a tooth and you got a big chunk of it broken off, you need a crown. If you got a tooth and you have a medium-sized chunk broken off, then you can probably have a filling. A crown may even be too aggressive in this scenario because in order to do a crown, you got to shave the rest of the tooth down. So this, you can probably have a filling done. And finally, if you got a little tiny part of your tooth chipped off, this doesn't even need anything. A, health-wise, it's fine. It's not going to harm your tooth, so you can just leave it as is. B, looks-wise, if it does bother you, we can just smooth it down sometimes. So something like this, I'll usually won't do a filling on because I've seen way too many situations where you had to do a filling on a tiny piece of tooth like this, and then you shave the tooth off more to do this filling, and then the filling breaks off anyway, and now the person is worse off than they were before. So that's why I don't really want to drill on your teeth and do a filling unless I have to. All right, so we talked about those first two ones. Now, number 3 is something called abfraction lesions. These are a little fancy terminology for teeth where your gums have receded a little and your tooth has caved in. You're going to get different answers from different dentists in regards to abfraction lesions and whether you need a filling or not. Once again, I'm very minimally invasive in my approach, so a majority of the time I'm usually not doing a filling on a abfraction lesion, and I've got another video devoted completely to this topic. Long story short, there's no decay and it's not bothering you, I'm fine leaving that alone. And now, if you do have a root cavity over here, and I see brown stuff and I poke at it, I'll recommend a filling. But if I don't see that, then usually I'm not recommending a filling on an abfraction lesion, but check out my other video for a much more detailed explanation of that. Another one, replacing old fillings. Once again, different dentists will tell you different things. For example, I've got a lot of patients that have old silver fillings in their mouths, and they're working fine. Yes, they are old. Yes, they're worn down. Yes, they're not that aesthetic. However, they're not harming you. They're not decayed. They're not broken. And for those reasons, I will usually leave old fillings alone if I don't see any problems with them. However, if a big chunk of that has broken off, or I poke around this and my instrument gets stuck in a hole, telling me that there's a cavity that has formed at the border of where the old filling ends and your new tooth structure and your tooth structure begins, then I will be recommending a new filling for it. Now, finally, this one's a little bit more complex, but root canal treated teeth, sometimes they need fillings, sometimes they need crowns, and that has often to do with the location of the tooth. So root canal, your tooth is hollowed out, and if it's a back tooth, a molar, this tooth needs a crown because it's got a big old hole in it and it's a tooth you use a lot for chewing. So if you have a root canal done on a back tooth, you need a crown on it. If you have a root canal done on a front tooth, a lot of times you can get away with just doing a filling instead of the crown. Now, another question is, my patients will ask me, Doc, what happens if I do nothing? Let's say they've been told that they need a filling, and I feel good about doing this filling, but they want to know what happens if I do nothing. Well, once again, it's not a simple question to answer. For example, if you have a chipped tooth, broken tooth, sometimes that tooth will be fine. So 95% of the time, the tooth will start hurting if it's got a cavity in it and it's not treated. So what I mean by that is, if, remember my diagram from before, if you got that rotten tooth structure, it keeps getting bigger and bigger and bigger and it gets to the nerve of your tooth. In that situation, yep, your tooth is often going to end up needing, having problems. So that is why you want to get fillings in situations like that. Tooth will start hurting, root canal extraction needed. Now, 5% of the time, the progression of the disease, every now and then, you can have a tooth with a cavity that doesn't get any worse and kind of stays. And what this is that tooth structure is not really completely rotten. It's more just weak. It's demineralized or stained. And like I said earlier, if you start brushing and flossing more and you cut back on how much sugary stuff you drink, we can hopefully prevent that from getting worse. And in those situations, your tooth is okay to just leave the demineralized tooth structure in there. I don't want to go drill on your tooth to make it, to fill it up for you. Now, broken teeth. Once again, sometimes okay to leave them alone, other times not. What do I mean by this? Well, if you have a big chunk of your tooth broken off and it's sensitive and more of it's probably going to break off, then you probably should fix it with a crown or filling. But if it's a small part of your tooth that's broken off and it's not that close to the nerve of your tooth, sometimes you can get away with doing nothing on it. For example, I'm a big music guy, and so many of you may know who this is. This is my boy Anthony Kiedis, lead singer of the Red Hot Chili Peppers. He has something he's known for, and that is his front tooth is chipped. And if you go back and watch the 1991 video of Give It Away, it starts off with a shot of his chipped tooth. And this is him just a couple years ago. So he's had this broken tooth for 30 years, and it's been fine. So yeah, if you have a small part of your tooth chipped off and you choose to do nothing, maybe fine. Maybe you won't give you any problems. But that doesn't mean it's always going to be fine. Finally, and then we already talked about fraction lesions and root canal. So at fractions, I usually don't recommend them. Root canal teeth, if you need a filling and crown, you should definitely get it. Otherwise, it will break off. So once again, I'm Atlanta dentist Andrew Kokabi, and thanks for checking out this video. I hope it has been helpful for you. We are here at Brookhaven Family Dentistry, which is a little dental office in the Brookhaven suburb of Atlanta. We've got a pretty awesome dental practice. We've got some really kind-hearted team members, some quality work gets done here, and we do a lot of good deeds for our community. So yeah, we've got a pretty awesome dental office, possibly the greatest office in all of Atlanta, maybe the state, maybe the world, who knows? But anyway, thanks for checking out this video, and I'll see you later. Hi, once again, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I hope you enjoyed the video. If you did, do me a favor and click the thumbs up button on the bottom of the screen. Also, if you live in the Atlanta area, then congratulations, because you live in a town where we have hundreds of wonderful dental offices, and ours is certainly one of them. I will say this though, we are one of only 3 offices in the North Atlanta area that have not only a perfect 5-star rating on Google, but also have over 600 Google reviews. So I'm pretty proud of that. Anyway, yeah, feel free to give us a call or stop by and say hi. Thanks.